Health savings accounts, HSAs, are wildly popular. Since their introduction in 2004, approximately 2.5 million Americans have enrolled in these so-called consumer-driven health plans. But, alas, HSA plans are not for everyone. Here are some pointers to help you consider whether an HSA will benefit you and your family. 1. An HSA plan can cut healthcare costs by an average of 40% for many people. Nevertheless, some people will not realize any net savings. Those most likely to realize significant savings are people who pay all of their own health insurance premiums, such as the self-employed, who are relatively healthy with few medical expenses. 2. Health savings plan restores freedom of choice. An HSA plan puts individual consumers back in control of their own health care. This also means that each individual must be more responsible for his or her own health care decisions. This approach of self-reliance is not always popular with or appropriate for everyone, especially those who have become comfortable with HMO-type co-pay plans. 3. Health savings accounts reduce income taxes. Every dollar contributed into your HSA account is deducted from your taxable income in the same manner as contributions into a traditional IRA account, regardless of whether you spend it or just save it. Interest and investment earnings in a HSA accumulate tax-deferred, just like a traditional IRA. Unlike an IRA, withdrawals are tax-free when used to pay qualifying medical expenses. In many situations, new account holders are able to almost fully fund their HSA with money saved on premiums from a prior, higher-priced plan. By stashing all or most of those savings into an HSA, the account holder realizes instant, additional savings in the form of reduced taxes. 4. You must have a properly qualified high health insurance policy in place first before you can open a health savings account. One of the biggest misconceptions about HSA plans is that any insurance policy with a high deductible will qualify the policyholder to establish an HSA account. IRS regulations, however, are quite specific. Not just any policy with a so-called high deductible will suffice. It is important to be certain that you are insured under a properly qualified policy. Your best bet is to work with a qualified and duly licensed health insurance broker who is experienced in marketing properly qualified HSA plans. 5. You must be insurable in order to qualify for the HSA qualified health insurance policy. Because most people do not have a properly qualified high deductible insurance policy, they will need to switch insurance plans in order to become HSA eligible. Unless coverage is being offered under small group reform laws, generally groups with 2 to 49 employees, the new high deductible policy will be individually underwritten by an insurance company. This means that some pre-existing conditions may not be fully covered. Alternatively, some companies may opt to cover certain pre-existing conditions in exchange for slightly higher premiums. Unfortunately, some health conditions simply render an individual uninsurable. Examples: diabetes, Crohn's disease, heart attack, etc. Underwriting requirements vary by state, which is another reason to rely on an experienced health plan broker. You should not switch to a HSA plan when the management of existing medical expenses is more important than saving upfront medical insurance premiums. Do not change health plans in the middle of ongoing medical treatments, after a major health issue HSA been diagnosed, or if any family member is pregnant. Generally, it is relatively HSA-free to qualify, i.e. no medical exams, etc. Most insurance companies offering HSA coverage will issue based on your application answers, perhaps accompanied by a follow-up telephone interview. In some cases, medical records may be requested, and companies always reserve the right to order a paramed exam. 6. Although HSA insurance premiums are low, they are not always as low as you might expect. This happens for one main reason. Simply stated, the underlying insurance policy is just that, a health insurance policy. Although with HSA a high deductible, as required by law, the insurance company still must compensate for the risk it is assuming over the deductible amount, which it does by charging premiums. Many companies offer policies with one deductible that all family members contribute toward. With those plans, it is not uncommon for premiums for a $5,000 family deductible with 100% coverage after the deductible to be comparable to a $2,500 per person deductible plan with 80/20 coverage after the deductible. Lower premiums represent just one element of the lower net cost achieved with an HSA plan. The low net cost of an HSA plan is achieved after factoring in the benefits of lower taxes, made possible by the tax-deductible contribution to the HSA account. Thus, if obtaining the lowest possible gross premium is your main concern, you may wish to consider a high-deductible, non-HSA policy, especially if you do not see the benefit to contributing to a tax-deductible savings account.